So I thought I'd maybe just talk to you a little bit about, I find there's such an interesting contrast of what the Republicans are trying to do in Washington and what you and Governor Pritzker have been able to do in Illinois. And so maybe that's a good way in to start with things, talking a little bit about those differences, including maybe starting with healthcare, which is something I know is very important to you personally. Hearing a lot about the Medicaid, drastic cuts to Medicaid coming down the pike. Talk a little bit about both what you and the governor have been able to do in Illinois and kind of what you're watching and worrying about coming out of DC.
Well, let me begin by just saying that healthcare is what really led me to run for office in the first place. And it was 10 years ago that I was caring for my mom who had Alzheimer's, and I was her primary caregiver. And at the time, I saw the previous governor of Illinois, as well as my state representative, work together to strip seniors of their health care. And this was health care that would help them to stay in their homes, to live with dignity. And it was essential. And I could not believe that there was an effort to take away health care from some of our most vulnerable Illinoisans, especially at a time that I was caring for my mom. She didn't get those benefits, but I knew how important it was for seniors like my mom. And at the time, I actually yelled at the television, this is 2015, someone should run against him. And speaking of my state representative, and I didn't know it would be me, but I saw that there was a need, and I felt that I was the one to step up and meet that need. And that's what I did. And that's what led me to run for office. And I ran and I won, and I ended up serving in the Illinois House. And so it was that story of my mother, who we actually lost the day before my campaign for state representative began. But it was that moment that really drove me to run for elected office. And here we are 10 years later, 2025, and we are seeing the exact kind of thing happen. People being stripped of their health care, people being stripped of SNAP benefits that will give them the opportunity to have healthy, nutritious food. And it's really another example of why I think so many of us are saying this is a time for courage. It's a time to step up. And it's why I'm running for United States Senator. What I will say in terms of the contrast here in Illinois, well, as we see the chaos coming out of Washington and efforts to strip people of health care, here in Illinois, we are expanding access to health care. We have stepped up to end predatory insurance practices, such as step therapy. We passed what's called the Healthcare Protection Act to make sure that people should be able to work with their doctors and not insurance companies to see what kind of care they need. We have eliminated medical debt. That has been so important, and something that I was proud to lead, for the administration was the Birth Equity Initiative that really focuses on addressing the maternal mortality crisis, which specifically impacts, disproportionately, I should say, impacts Black women. And so there's so many ways that we are working to make sure that people have access to health care, that it's expanded. We just passed legislation and the governor signed into law to lower the cost of prescription drugs, because that, again, was another area where we saw it was not only too expensive, but I've talked to seniors who have said, I've had to cut my medication in half so that I could stretch it. That shouldn't be the case. So I'm disgusted by what's happening in Washington right now. But I'm really proud of what we're doing in Illinois. The governor and I are working hard to make sure that we center the voices of middle-class families, working families, who are really just trying to make sure that they have the lives they deserve. And that's what we'll keep doing.